My name is Aita Susi. I used to be a pediatrician, and now I'm a child and adolescent psychiatrist, and I work with families and children in the area of ADHD. So treatment. We want to get the ADHD brain back online. And we do that with medications that stimulate the brain. We're stimulating those two parts of the brain to start to work. We also want to provide modifications that reward and stimulate the brain. Like you take out the trash 3 times when I only ask you once, then you get a star or you get a little reward, a special time with mommy, daddy, however you want to work that. And we want to teach family members and teachers how to work with an ADHD brain to get the best results. Take-home message, the ADHD brain needs to be stimulated. Once stimulated, it's working great. All right, so the MTA study. This is a very, very famous study that took place in 1999. 14-month study with a lot of kids. Getting 500 children to participate in the study, this is a big deal. They had 4 groups of kids. One group received meds. Another group received behavioral therapy. A third group received a combination of meds and behavioral therapy. And this 4th group was followed but did not receive any of these treatments. They just did whatever the parents wanted to do, called usual community care. All 4 groups had a reduction of ADHD symptoms, but there was significantly greater improvement in the medication group and in the combination group, with those in the medication group doing a little bit better. So when the study was completed, the take-home message was, medication is the best, give your kids meds, and everything's going to be all right. Then they did a 2-year follow-up at the end of the study. They stopped the study, everybody was sent home, do whatever you want to do, and they recontacted 500 kids, 500 families. It was a lot of work. And what did they find out? Everybody who'd been in the study did better than those who received no treatment at all. But there was no difference in symptoms between any of the groups. Everybody equalized. So then the take-home message became, it doesn't matter what you do, but do something when you treat ADHD. If you want to do meds, do meds. If you want to do family training, do that. It doesn't really matter, but address the issue. What are the risks of not treating? Problems at school, problems with self-esteem, problems with emotions, physical injuries, and higher rates of substance abuse. We've already gone over some of this stuff. Basically, a child who has ADHD who's not treated has less chances of living to their full potential. And that's really a key point. All these kids have a lot of potential. You just want to do what you can to bring it out. A little bit about medications. There are 2 types. Short-acting and long-acting forms exist in both types. There are the amphetamines, things like Vyvanse and Adderall, and then the methylphenidates, Concerta, Ritalin, Metadate. If those don't work, meds that are used less often are Strattera or clonidine. But these are the 2 types of medicines, and it's equal. Some kids respond to one, some to other. I really don't feel that one is better than the other. And behavior modification. I am of the camp that you need some behavior modification, okay? Behavior breaks down when the demand placed on a person exceeds their ability to complete the task. If you ask an ADHD kid to put on their coat, get their hat, and get their homework, okay, you've exceeded their ability to complete the task. They can't do it. Behavior breaks down, mommy gets mad, you have a meltdown before school even starts. So you have to learn how to work with your ADHD child. You do want your child to develop the skills to master life, meaning you can't just coddle them and do everything for them because they're going to go to college and they need to know how to handle life. So learned helplessness can be a result of not taking the time to teach your child with ADHD how to master life. Message is, pills don't teach skills, and pills can be helpful.